executive director at the Free Medical Clinic. And as you know, that's a nonprofit organization that provides health care, primary care, and wellness services to low-income, uninsured residents of Anderson, Morgan, and Roane counties. Before coming to the Free Medical Clinic, Jackie worked in the city of Knoxville with a focus on crime reduction programs. She has a bachelor's and master's degree from UT in social work with a concentration in nonprofit management, leadership, and community practice. In 2009, she authored a paper, The Intersection Between Physical Health and Mental Health, A Global Perspective. She's received a number of awards for her work over the years, and she's now a member of the Leadership Oak Ridge class, which I've worked with that organization for over the years as well, and I'm proud to see her involved in that. And she was also an inductee in 2015 in the Greater Knoxville Business Journal's 40 Under 40. And she's here this morning to talk to us for a few minutes about the Free Medical Clinic. Jackie, would you come up, please?
Good morning, everyone. And I really appreciate the opportunity to speak with you all this morning. And first of all, I just want to say that I'm truly grateful for the support that you all have given to the clinic over the past almost 2 years. There's so much support that's needed, but you all have already stepped up to the plate and given to us, and I just want to let you know that we appreciate that so much. Frances was just telling me that she came in last week and brought in a personal donation, and it's things like that that allow us to continue the work that we're doing. We do provide primary care to individuals without insurance in Anderson, Morgan, and Roane counties. And in doing that work, we use a set of guiding principles because we don't want to just serve people. We want to serve them in a way that is meaningful and impactful. So our first guiding principle is that we believe that everyone is entitled to adequate health care, regardless of their ability to pay. Everybody deserves to receive health service. Number two, we believe that all of our patients are worthy of dignity and respect. So when you leave the clinic after seeing one of our providers, we want you to go out feeling like your self-worth is still intact and that nobody looked down on you. And we think we're doing a pretty good job of that. People are able to rate our clinic online. And one woman noted that when she left, we made her feel like she was paying in gold. And so that to us makes us feel like we're really doing what we're supposed to be doing when people are able to get the service that they need, but they leave out of our clinic feeling good about themselves. And our third guiding principle is that we believe that the best thing that we can do is empower people with knowledge so that they can make really good decisions about their own health care. You know, we believe that if you give people the knowledge that they need, that when they go to the grocery store, they can pick up the items that are healthy for them. So we have a lot of wellness classes where we teach people how to buy healthy food on a budget. We could even give them a gift card from Aldi or Kroger. And our wellness director will go with them and show them how to pick items that are good for them if they're diabetic. One woman who went on this shopping trip with our wellness director actually cried because she did not know how she was going to eat. So the food that we gave her with that gift card helped her to have healthy, nutritious food for that week. Last year, we saw about 4,500 individuals. Now that's a lot, but that really is only scratching the surface because in Tennessee, there are over 200,000 people who would qualify for our services. And in Morgan County, one of the counties that we serve, 18% of the residents are without health insurance. That means we're still only scratching the surface of the need that's in our community. And these people are people who, for whatever reason, fall in the healthcare coverage gap. They may have had a job with benefits, but they were laid off. They may be waiting to see if they get their disability benefits. They may not make enough money to qualify for a plan through the Affordable Care Act in the marketplace, but they make too much money to qualify for TennCare. So what do you do when you fall in the gap? Where do you go? And so the free medical clinic really exists to serve those people who, for whatever reason, fall in the healthcare gap. And now with the question mark that's on the Affordable Care Act, we don't know if it's going to be repealed or replaced. That's still in discussion. But if it is completely repealed, then that means we're going to have an influx of patients. So we're still waiting to see how that works itself out. But we are able to do this work because of people like you. We have a donor base of about 1,300 individuals who give to the clinic. They give their time, they give their talent, they give their treasure. One woman sends us a monthly donation of $7 in an envelope, and we are just as grateful for that $7 in the envelope as we are for the person that can give us $5,000. And we're grateful for books, magazines, personal care items, because if you're on a fixed income and you have food stamps, you can't buy toothpaste or toothbrush or tampons or allergy medicine over the counter. Those are things that we take for granted that someone who's on a fixed income is really, really grateful for. So we have a shelf in the clinic where we allow each patient, when they come in, to take 3 items off of that. We're able to do that with this work because of those 1,300 donors, but also because of our volunteers. We've got a very strong volunteer base of doctors, nurse practitioners, physician's assistants, 55 of them who give of their time to make sure that people get the care that they need. And they do it because they just love this work. A lot of them see it as an extension of their ministry. They also participate in medical missions trips all around the world. And then when they're in the States, they will donate their time to the clinic. In terms of our patient demographics, about 80% of our patients are from Anderson County, and about 15% of our patients are from Roane County. We just opened a new clinic in Harriman in October of last year, and that clinic is growing. So we're hoping that those numbers will increase. And then about 4% of our patients are from Morgan County. That for us is a real opportunity for growth. If you know of anybody in Morgan County who would allow me to do a presentation like this, I'd be very happy to speak with you. In terms of our patient ethnic makeup, about 75% of our patients are Caucasian, about 7% are Hispanic, 6% East Indian, and less than 1% are African American. That's another area of opportunity I see for us because we know that there's a need there. So I am doing some outreach in African American communities to try to increase those numbers. In terms of the services that we do offer primary care, but we also offer some specialty care. So if we have a patient that comes in that has diabetes, we can help them with the management of their diabetes and actually get them on the insulin that they need to control their blood sugar. We also do some women's health programs. So if a woman comes in and she needs a pap smear and a pelvic exam, well, we can do that for her. If someone needs lab work, there is a limited amount of lab work that we can do in-house, but we have a great partnership with Roane Medical and Methodist Medical where we can send our patients there and they do not incur a fee to do labs that they do in-house. If they send that lab out, then the patient would incur a fee, but we do have a laboratory assistance fund that we can use so that payment of that lab is not a barrier for them getting the care that they need. And then finally, in terms of our services, we have a comprehensive wellness program that includes classes like smoking cessation, cooking matters, where we teach you how to cook on a budget, and diabetes prevention. We estimated that The amount that we get from people donating prescriptions to us and the labs that we get from Methodist and Rome Medical average up to about $750,000 a year. That enables us to see the patients that we see, but give them an excellent level of care. I want to read to you just some of the patient comments that I pulled off of the internet about us. One person says, "I am grateful for the free medical clinic because they have kept me on track and healthy with managing my diabetes." And another woman says, "I am so thankful for all of you. You are such a blessing to me. I'm glad God made people like you." And this third one, this is one that I mentioned earlier. "This has been a godsend for me. I can't afford to pay to see a doctor, but when I went to the free medical clinic, you treated me like I was paying in gold." And that's really what it's all about. You know, we want to see people served, but we want to see them served in a way that makes them feel good about who they are. And we do believe that everybody deserves to have access to medical care, regardless of their ability to pay. And I just want to encourage you to continue to support the clinic, because we really cannot do this work without people like you, and doctors and nurses that just care about seeing people be served. So I just want to say thank you for the opportunity, and thank you for your continued support.